Good afternoon, and thank you for joining us today for the latest update on the 2019 novel coronavirus, or COVID-19. Just 2 weeks ago, we reported our first 2 cases of COVID-19 in Montgomery County. As of 12 a.m. this morning, we have 80 new cases of COVID-19, bringing our statewide total to 268 Pennsylvanians who have tested positive in 26 counties. That is an increase from 2 counties to 26 counties in 2 weeks. On Wednesday, we had 37 new cases in a day. Today, we have 83 new cases in 1 day. So in just 2 days, we have doubled the amount of new cases. Approximately 26 Pennsylvanians have required hospitalization since March 6th, when we confirmed our first case. That's approximately 10%. The exponential growth of new cases in the new counties where they are being detected shows the need for the aggressive steps that the governor has taken to mitigate and prevent the spread of COVID-19. While we continue to be concerned about the spread of this virus to seniors, a preliminary analysis from the CDC this week shows that 20% of all hospitalized patients in the United States are actually between 20 and 44 years of age. The report states that in other countries, nearly 50% of all confirmed cases were in people younger than 54 years of age, and almost 40% of the hospitalizations were in that age bracket. We are seriously concerned that individuals in the 20 to 44 age range are not heeding the message to stay home and are creating an unnecessary risk to themselves and to others. This could lead to a significant impact on our healthcare system. Now, we are communicating and collaborating with health systems and hospitals to determine their current capability to handle a surge of hospitalizations with patients that have COVID-19. We are looking at every option to add capacity to our hospital systems to care for Pennsylvanians in need. We are looking at space considerations, staffing, and supplies of necessary equipment, as well as standards of care for treatment. Now, Pennsylvanians are problem solvers, and our best experts are looking for ways to care for us all. The one thing you can do to control the spread of the virus, COVID-19, is to stay home and limit your interactions to your immediate family. That is the only way we can make sure that people don't get sick. That is the only way we can make sure that people don't need to be hospitalized. That is the only way we can make sure that we don't strain our healthcare system to the point that it breaks. That is the only way that we can make sure that our economy recovers quickly. Pennsylvanians must stay calm, stay home, and stay safe. Now for my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time that it takes to sing Happy Birthday twice, or use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. Try not to touch your face after touching surfaces, and clean surfaces frequently. Practicing these everyday preparation and prevention measures can help slow the spread of the virus, COVID-19. If you have questions about your health, please contact your health care provider. If you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe.